Hi, everybody. Today, we're talking about consent for treatment. Caregivers are asking about, what does consent for treatment mean? What am I agreeing to? What am I not agreeing to? So I'm going to share some examples and stories and put this in the context of hospital care, medical treatment in a doctor's office, their recommendations, and the care provided to you as the patient or to the loved one that you care for if you're the caregiver. So stay with me as I explain what this means in the context of various healthcare settings, and know that you as the caregiver or the patient, even if you sign a consent to treat form, still have the right to ask questions and even to change your mind. This is critically important, especially if you have a loved one who has any type of memory loss. Early memory loss, dementia, Alzheimer's, Parkinson's, a brain injury, any type of cognitive concern where they may not be able to understand what's being recommended or evaluate the information or make a good decision, and they need your help. I'm Pamela D Wilson. I am a caregiving expert and advocate of more than 20 years. Please click below to follow, like, and share this channel as you help other people find these videos by your participation. I also invite you to comment below, even if it's something simple to say, hey, thanks for the video. That again helps other people find these videos, so you by your participation are actually helping other people. So what is consent to treat? It's a piece of paper, it's a form that you sign whenever you go to a medical location. So a doctor's office, a lab, a treatment center, a physical therapy clinic, a nursing home, a hospital, right? And the problem is they hand you all these papers and so many people just sign them without reading them. So this form gives the provider permission to treat you. However, you have to realize this is not just a blanket statement of like, yes, I agree to whatever you want to do with me, right? This idea is kind of like similar. The way that you can compare it, I guess, to a real world situation is you take your car into the shop because you need an oil change and there's this little noise that you hear and you want them to check it out, right? So you either wait there or you get a phone call and they say, yes, we can change your oil. And by the way, X, Y, and Z needs repair. And the cost for X is this, and Y is this, and Z is this. Do you want to do all of them? Do you want to do one of them? What do you want to do? So basically, after giving your first consent to have them work on your car, you're now giving them a second consent to do 1, 2, or 3 more things, or none. And they give you the estimate, and you sign, and they go forward. Now, in the medical world, if you're having a health emergency and you go into the emergency room, right, they're going to have you sign the consent to treatment. And if the, quote, repairs to your body are time sensitive, they're just going to do them. They're not going to come out and say, oh, you know, your loved one's having a heart attack. Do you want us to take care of that? Or they're bleeding. Do you want us to take care of that? No. In a medical setting, they're just going to take care of it. But beyond the emergency situation, right, there can be a lot of other things that need to be done, treatment recommendations. So this is kind of what I call the tricky part, right? So as the caregiver or as the patient, you have the right to ask all the questions you want to ask, and you should ask questions. For example, why a medication is being prescribed. If you're in the hospital, why are they putting up another IV bag? And you can even ask to see the IV bag and the name of the medicine on the IV bag so that you know what is being put into your body. This right is perfectly your right to do. And so many people just don't do it. They just think, well, doctor wants me to take this medication, I'm going to do it. They want to put that into my IV bag, I guess it's okay. Well, sometimes it's not okay if you're allergic to a particular class of drugs or you have a reaction. So it's really important to know what you're being given, and especially if you have a reaction, to document that so that there's something in your file that says, don't give me this again, right? So all these little things are important. Now, consent to treat obviously happens in a number of ways. You go into the emergency room and you're too sick to just say anything. So you sign the piece of paper and they do whatever they need to do under the circumstances. Same thing if you're going in for surgery, right? Because you're not going to be awake during the surgery. The doctors can't like poke you and say, hey, do you want us to do this, right? They're just going to do whatever they need to do. But then there's the other side, which is you're in a doctor's office, or maybe you're in the hospital and you're awake and you can talk about treatments and ask questions. So know that you have a right to ask about every little detail that is being done, even though your doctor might seem rushed, or the staff at the hospital might seem rushed, or people in a physical therapy clinic or treatment center might be rushing around, right? So while their time constraints may affect you, right, you deserve their time for explanations and to have your questions answered. So let me share just a couple of stories to help you understand consent for treatment in other situations where maybe you're the legally responsible party and you're not there, or you're with the patient and decisions have to be made. So the first one is I was a guardian for a woman who had memory loss, Alzheimer's, and she was in a nursing home and she permanently lived there. Now, my guardianship paperwork was on file. And in the chart, I put this big note that says, do not change treatment recommendations or medications without calling the guardian first. Here's my name. Here's my phone number. So what happened one night is I get a call from the nursing station. And the nursing station says, oh my gosh, Mrs. Whatever is having high blood pressure. We're worried about, she might be having a stroke. And so my first question was, did anyone change her medications? And guess what? Doctor showed up that morning, looked at her med list, didn't think that she needed her evening blood pressure pill for whatever reason, and he discontinued it. Nobody called to ask me. I didn't agree. What probably happened, and it happens a lot, especially with people who have memory loss, and the doctors don't understand the memory loss, or maybe they do. The doctor probably went to my client and he said, hey, you know what? We're thinking of discontinuing your evening blood pressure medication. Are you okay with that? And my client, not even understanding what he asked or the consequences of what he asked, probably said, sure, that's fine. So doctor's like, okay, I have permission. I'm going to discontinue this. And within 12 hours, less than 12 hours, we have problems. So why does this happen? Well, sometimes the staff really doesn't understand that the person with memory loss doesn't understand and can't make those decisions. Now, if there's a note in the chart, that's a whole different story, right? Sometimes they're rushed. Here, the staff don't want to actually take the time to pick up the phone and call somebody and say, hey, we're thinking of making this change. Is it okay? Do you have any concerns? Is this good? Right? Now, I'll tell you, nursing homes are particularly advanced in this aspect because they want to discontinue as many medications for older adults as possible for the residents because they get measured on this. And so what that means, though, is they may not call the responsible party to get permission. Then something bad happens to the client. The client gets sick, right? So instead, you have to be that squeaky wheel. You have to be the person who puts the note in the chart saying, no changes unless you contact me. Even next to the bed, no changes unless the power of attorney is called or the guardian is called. Or if there is a fall or any change in condition, I want to be the one to receive a phone call right away. Not 6 hours later, not 12 hours later, not the next day. If you are managing the care for a loved one and you are the responsible party, you've got to be very proactive in telling doctors and hospitals and nursing home staff and other care staff exactly what you want and what you expect, so that they don't just put your person in the category of the other 50 people that are there and treat them the same way. So we can also put this medication change into perspective. Let's say that you have high blood pressure and you take medication and you're taking your blood pressure and you're like, wow, my blood pressure is just so great. I'm doing so well. I think I don't need these pills anymore. So you know what? I'm just gonna stop. And then of course something happens. Now, same thing for you. the reverse. If you are thinking of changing your medications or changing a treatment, discuss it with your doctor, because there may be things that you don't know about just stopping that medication right away, especially if you have a condition that really would benefit from another different medication. So the reason your blood pressure is good is because you're taking the medication. You stop the medication, all of a sudden, your blood pressure may go sky high. You may have other cardiovascular problems. You could have a heart attack. So just because everything looks good on the surface, whether it's a doctor looking at it or you as a caregiver or a patient looking at it, doesn't always mean it's good on the surface. You got to ask questions. So I will say that doctors in care communities, assisted living communities, memory care nursing homes, they are truly really bad about seeking approval to change medications. So that's a place where patients and caregivers have to be really adamant about the process. So another risk to treatment, and this is like more advanced that you may not know about, is let's say that you have a loved one going in for surgery and they have a living will that says no extensive treatment, and they have a document called a DNR, do not resuscitate, or a MOST form that says, if my heart stops and I stop breathing, let me go, don't bring me back. But what you may not know is if somebody's going in for surgery, they have the patient sign a form that says, I know I have a DNR. I know I don't want to be resuscitated, but I'm going to allow you to do this during surgery, right? So again, if you have a loved one with memory loss, they're going to be handed a clipboard and a pen and a piece of paper, and they're going to say, sign here. Your loved one's going to have no idea what they're signing, right? So again, you've got to be there when that paperwork is signed if you are that power of attorney or the guardian, right? So this is going to happen regardless of whether you want it or not, because this is just the way surgery goes. You're going to have to rescind or agree that your do not resuscitate is not going to be listened to or agreed upon. Okay, but there's still something you can do. You can have a conversation with the doctor, the surgeon, with the anesthesiologist when they come in to talk to you before surgery, or your loved one before surgery. Say, look, I realize that we need to suspend this DNR because medication complication could happen, something crazy could happen during surgery, and I or my loved one can stop breathing and our heart stops, and if it's something little, of course, bring us back. But if you're out for a minute or 2 minutes or 3 minutes, the important thing to know is the longer your heart is not beating and you are not breathing, the greater likelihood that there is going to be some type of brain damage, some type of cognitive damage. So do you really want to come out of surgery and be in a condition where you don't remember anything, or you can't get out of bed, or you're extremely, extremely disabled? The answer for most of us would be, well, of course I don't want that. So the discussion to have again with that surgeon, with the anesthesiologist, before you go into surgery, and even after you are pulled into surgery and you are laying on that surgery bed, before they give you that anesthesia that puts you to sleep, you can say, look, I know I signed a piece of paper that said you guys can resuscitate me if something happens, but truly, if I'm out longer than a minute or 2 minutes or 3 minutes, stop trying to bring me back, because I don't want to come out of this in worse condition than I am right now. If I can't go golf, or I can't hike, or I can't go see my grandkids, and I can't travel, that is not going to be the type of quality of life that I want if I am so disabled that I can't do any of this stuff. So please let me go. Now, they're going to have the decision to pay attention to you or not. There's really nothing you can do in this case, but it doesn't hurt to be very clear about your wishes more than once. Another story. So consent to treat. So I had a client who had a mammogram and she needed to do a follow-up. So I took her to the imaging center at the hospital and they did a scan. And the radiologist called me in and he said, well, I want you to see this scan and what's going on. I'm like, okay. So he pointed to all of these spots and I'm like, okay, what are they? And he's like, well, they're calcifications. And I said, well, what happens with these calcifications? And he said, well, they can turn into cancer. And I said, okay, how long? What's that time frame? And he said, well, it could be 5 years, 6 years, 10 years. We just don't know. And I said to him, I said, my client has pretty advanced Alzheimer's disease. And she probably is not going to be around in 5, 6, or 10 years. So I know you're recommending a follow-up treatment and a biopsy and all that, but we're not going to do that because I don't want to put my client through that scary procedure, and it could be painful. And we're going to find out that she has cancer or doesn't have cancer, and we're not going to treat it because of the Alzheimer's. So he was not happy with me. But again, that is your right to say, yes, I want treatment. No, I don't want treatment. And so for all of these reasons, it's important to really read all those documents. I know the legal language can be confusing, but read the documents, understand what you're signing in a medical office or in a hospital relative to the consent for treatment or billing or whatever. It's easy just to sign them if you're in a hurry, but if you sign something, you may be consenting to something that you don't want. It's also very, very important if you go for tests or have test results to make sure that you get copies of those test results and that the doctor discusses them with you. A lot of times this falls through the cracks. Doctor sends you for treatment. His office gets the results. Nobody in that office ever calls you to talk to you about the results. And so you think everything's okay, so you never pick up the phone to call them either. That can be an event that has severe consequences, okay? Especially if, let's say, you go for a heart test and that test says, oh my gosh, that you have a clogged artery into the heart that could cause a heart attack, or maybe you have a heart valve problem, or maybe the test showed some spots that might be cancer, but the doctor's office never calls you to discuss them. And you're like, whew, I didn't get a phone call. I must be okay. So you're assuming everything's okay, but everything may not be okay. So again, if you're consenting to a treatment, you're consenting to a test, make sure that you follow through to get those results and you know the next steps and you know the consequences. Now, it's also important, let's say that your loved one agrees to a treatment, right? And it's going well or it's not going so well. You can change your mind in the middle of that treatment. And the treatment could be just like you agreed to take a medication and it's making you sick. You have to tell the doctor so that the doctor can change the medication. Or maybe I have known patients who agreed to have dialysis and years later they're like, you know what? I know this is keeping me alive, but I'm just done with it. I don't feel well. And if the consequences are that, I'm going to die, I accept that. So all of these consents go both ways. They can be very positive. They can lead to unintended consequences. You have the right to ask questions. You can change at any time. But it's always important to discuss all of this with your physician. So the caregiver, patient, doctor communication is extremely important in all medical care. And I know that doctors can be so intimidating because they talk with all these big words and all this language. Make yourself be comfortable to ask questions and to receive information and to make sure the doctor knows what information you want to receive. Now, doctors, on the other hand, who may not want to give bad news or are not comfortable giving bad news, may only tell you part of the story, waiting for you to ask the other part of the story and more details. That's up to you. You have to ask if you want to know. And especially if they say something and you don't understand, you're like, what does he mean by that? Should I agree to that? Should I not agree to that? Ask questions. Because a lot of people will say, well, the doctor never told me that. Well, if you don't ask, if the doctor doesn't know that you don't understand what they're explaining to you, they're not going to give you more explanations. And honestly, I know sometimes patients and caregivers just don't know what to ask. So learning how to work with healthcare providers to have this give and take relationship and to get information and get your questions answered is so important. So when it comes to all of this, informed consents, paperwork that you have to sign, test recommendations, treatment recommendations, make sure that you know what you're agreeing to today and in the short term and in the long term. Now, in some cases, there may be a nurse in the doctor's office or some other care staff who can spend more time with you outside of a 10 or 15-minute doctor appointment. And they may be able to give you resources, paperwork that you can read, brochures that you can read, websites to go for information, offer you more explanations if your doctor doesn't have the time. Separately, and this is a huge benefit that is offered by most health plans, most health insurance companies have a 24-hour nurse line, or they have a care coordination line that you can pick up the phone and call, and you can say, hey, I went to my doctor and this wasn't explained. Can you explain this diagnosis to me? Or can you explain the side effects of this medication? Because this stuff is happening and I can't get into my doctor's office and I just want to talk to somebody so I feel better about what's going on. Make use of that support. It's part of your health care plan. And it can help you really gain a better understanding of what is going on with everything relative to your care so that you have peace of mind and you feel comfortable and a little more in control of what's going on. Because I know the more that all of us become involved in health problems and dealing with healthcare systems, it can get very, very confusing and scary and frustrating. So the key is you've got to make the effort to be interested, to ask questions, never feel that you are a bother or that your needs or the needs of your loved one are unimportant. I'm Pamela D Wilson. I thank you for being here. I am a caregiving expert, advocate, and speaker. Please do click below, like, share these videos, comment. It helps other people find the videos through your actions. Go over to my website, PamelaDWilson.com. So much help and support there. I have 3 online courses that are absolutely free: how to care for your aging parents, information about power of attorney, and guardianship. My podcast, The Caring Generation. There are links to all of those podcasts there. There's links to all the apps that you can listen if you want to listen on Apple or Spotify or Spreaker or another site. I also have a caregiving group on Facebook. It is called The Caregiving Trap. It's private. You can request to join. I have a book called The Caregiving Trap. I have over 800 videos here on my YouTube channel. So information is here for the asking. It's free, no charge. If you want to schedule a consultation with me that is paid, you can do that through my website by clicking on the Contact Me button. Thanks for being here. I'll see you all again soon in another video.